I'm joined in the studio today by John Ray, the CEO of Haven Home Health and Hospice. John, it's a pleasure to have you here.
Thank you, Mitch. Good to be here.
Well, I have a question for you. Medicare is extremely complicated for me, and while I'm not at that age yet, I see it right there on the horizon. I've seen a lot of different advertisements and talk about Medicare Advantage. Can you tell me what that is?
Yeah, Medicare Advantage, it is, what they've done is they've allowed for-profit insurance companies to take the Medicare benefit, so there's a stipend per member, and they pool that money, and then they decide what care is provided to that individual.
I see. And so if I were a consumer, how would that benefit me?
Well, as a consumer, there are other benefits that come with Medicare Advantage. Some offer some dental care and some, a gym membership and some other things that come depending on the Medicare Advantage. Some perks, yeah, absolutely.
And how might it not be an advantageous thing to join in with Medicare Advantage?
Well, not all of them are created equally. These are for-profit companies, and so you have to be careful because some make profits in different ways. And if you Google this online about Medicare Advantage and delays in care or denials of care, it's a lot more prevalent in the Medicare Advantage space. And some people might argue that that's a good thing, gatekeeping so we don't overpay for medical services. But sometimes that can go too far. And so some people might not get all the care they need when they need it sometimes.
Can you give me an example of that, of how that benefit might be changed under one Advantage program rather than another one? Yeah,
one example in my organization, we have a home health, and so there's one of the Medicare Advantages that we have to get pre-authorization, which usually isn't a problem getting our first visit, but then we'll do the visit, we have to turn in the notes, and then legally they have 14 days to let us know whether we can do an additional visit. So we have to turn in the paperwork, they have time to say, can we have another visit? They'll give us another couple visits. Well, what that does is it slows down our ability to take care of somebody who might have a more urgent need in their home. And so we just want to make sure that people understand that sometimes even if the doctor says, I want it this frequently, and even if the home health agency is like, we should do it this frequently, the Medicare Advantage is really deciding whether or not that's going to happen or not. And that can be good or bad depending on this situation.
Is there any resource if I was wanting to get more information that I could find out what might be the right program? Yeah,
I highly recommend, there's a group here in Missouri, and it's medicareschool.com. And that's a website, and he also has a YouTube channel. And so he goes through and explains things in a very specific way, so it helps people really understand what the differences between traditional Medicare and Medicare Advantage are, and some of the pitfalls to look out for, and how these contracts change from year to year, and to make sure that you're going to make an informed decision. People shop different items all the time. And sometimes, just to save a couple of bucks, we're talking thousands of dollars in difference in the amount of services and care that's being provided, just based on picking the right insurance. And so whether that's traditional Medicare and a supplement, or whether that's the right Medicare Advantage plan, we just want to make sure that people know that there is a big difference. And we're, unfortunately, in our society, it is very much a consumer beware type society. People have to make informed decisions, and especially around their insurance.
That makes great sense. And you guys deal with them all across the board. So if someone wanted to get a hold of you, how would they go about that?
Yeah, they can reach us at our phone number. Our main number is 417-581-1234. We're based here in Missouri, but we cover 29 counties, so we cover a large area. And they can also reach us at havenhome.us.
Well, John, thank you so much for being here. Thank you for clarifying that. It's such a complicated procedure. Thank you.
Thank you, Mitch. Appreciate it.